Case number 14, a biopsy sample of an atypical liver nodule, a small one. It measured only 2 centimeters, and it was developed in a patient with cirrhosis that was related to obesity and metabolic syndrome. So as I said, the nodule was atypical without any wash-in or washout on imaging, and it was thus decided to perform a biopsy to make a diagnosis. So now let's take a look at this core biopsy, small one. Now let's take a look at this fragment, some fibrosis, hepatocellular nodule with very little or no atypia, some steatosis, maybe some remnant portal tracts. Again, here fibrosepta, so it looked like cirrhosis. Again, some hepatocellular nodule, no or very little atypia. The same here. Again, some vacuolated nuclei, glycogenic, also called glycogenic nuclei. So that's it for this core. And now we take a look at the other fragment of the biopsy here. Some fibrous tract. And also now we are in a particular part of the biopsy, and the appearance is slightly different from the other hepatocellular nodules that we saw previously. First, you have an increase in cell density here compared to this hepatocellular nodule. You have an increase in the nuclear to cytoplasmic ratio. The architecture is not exactly the same. Some pericellular fibrosis, some isolated arteries. Here again another one. Here again an artery. And you can see clearly here the increased cellular density. So what do you do when you see something like that? You want to do some immunohistochemistry to confirm your impression. Here it's another fragment. It's more difficult to say what it is, but maybe also it's a part, probably it's a part of the tumor. And what you can order for immunohistochemistry, I think if you can order one marker, you will have to order glypican-3. In this case, it was positive, but even if it was negative, this part of the biopsy is highly suggestive of hepatocellular carcinoma because of all the criteria we saw before. But you can see that the carcinoma is can only be identified in a small part of the core. So it's not that rare, so that's why I should really advise you to look closely at all the fragments, all the parts, because sometimes it's very difficult to localize small nodules, and you may have malignant proliferation only at the end of the core biopsy. You may have only 20, 30 cells, but it may be enough to have a diagnosis. So here the diagnosis was hepatocellular carcinoma. And briefly, to resume, you have here this increased cellular density, this modified architecture, the pericellular fibrosis, the isolated arteries, and the increased in nuclear to cytoplasmic ratio.